Local hospital birth centers have been the place of generations of families starting their homes. After a months-long fight, those services will now stay open. Tayton Torgrimson explains how nurses and the Lebanon community made it happen.
They've made it clear that birth centers aren't just medical facilities. They're a part of the community's story, and now families can celebrate knowing that these services will remain. For over 80 years, families in Lebanon have counted on the birth center at Lebanon Community Hospital. But in May of this year, that history was in jeopardy. Samaritan Health Services weighed shutting down labor, delivery, and emergency surgery services at the hospital. And although the group didn't want to do that, costs as well as an assortment of other issues were appearing to be too much. Leaders of the movement opposing the shutdown stuck with the precedent that great care in their maternal services would lead to generations of care coming from that same family.
That is the one place in the hospital people want to go to. That is one memory they will carry with them for the rest of their lives. And if that is done well, they will go back to that hospital again and again for the rest of their care.
The Oregon Nurses Association rallied alongside parents, first responders, and elected leaders, sending in over 21,000 letters for the Samaritan Health Services Board to read. The message simply displayed as "Keep rural care accessible."
What we've been saying this whole time is every minute matters when we're talking about oxygen to that baby or a mom bleeding or something that needs to be addressed as an emergency.
Now, with the company committing to keep these services, the community can look ahead to future generations of families beginning their stories in the hospital. Reporting in Lebanon, I'm Tayton Torgrimson.